If you're suffering from sciatica, you're probably looking for ways to relieve the pain quickly. In this video, I'll share 5 effective self-massage techniques for sciatica that are particularly effective for people over the age of 50. So let's jump right in. In younger people, sciatica is often attributed to herniated discs. And in that case, many people will tell you not to bend forward. But over the age of 50, the most common cause of sciatica is actually loss of disc height, which is due to degenerative discs in the lower back, and that can narrow the spaces where the nerve roots that make up the sciatic nerve exit the spine. That's sometimes referred to as spinal stenosis. And in that case, forward bending actually opens up the spaces where the nerves come out of the back. So that's where our first technique is going to start out. It's going to massage the back muscles that hold your spine in extension so that they can get into a more relaxed position. And to do that, we're going to start out for this one on the floor. Now, if you cannot get on the floor because of your sciatica pain, it is okay to do this on a bed or on a couch, but it is more effective if you do it on a hard surface, particularly on a rug, maybe not a hard floor. So first you're going to lay down on the floor like this, and then you're going to bring your knees up towards your chest. This puts you in a flexed position, but it also presses your lower back down into the rug. Now from here, you're just going to do a gentle rocking back and forth. So this opens up the spaces where the nerve roots come out of your spine, and then it massages the back extensor muscles as you rock back and forth. Now, when you're in this position, you can also do some exercises here, such as doing a sciatic nerve glide. Now, note this should not be painful. So if this is painful to do, only go as far as you can comfortably, or just don't do it at all. You can do one leg at a time, or if it feels comfortable to you, you can do both legs as well. But for the massage technique, you just rock back and forth like this. Now again, if you can't get on the floor, you can also do this on a better couch. You just don't get as firm of a massage because the surface is a little bit softer. So for that one, I would recommend using the floor if at all possible. Now for the next technique, you can do this one either on the floor or on a couch. To do this, you'll put your feet up on a couch or on a chair like this, and then you're going to press in front, kind of by your abdomen, a little away from the midline. Now this releases a muscle known as the psoas. The psoas is a hip flexor muscle that attaches to the front of the spine. And because it's located on the front of the body, whereas sciatica is in the back of the body, people often overlook the psoas. But because of its attachment to the spine, it can create a massive compression load on your lower back and compress the nerve roots of the sciatic nerve. So to release this muscle, you'll just press in with your fingertips like this and gently sink into that muscle. It's not right in the midline, and it is inside of your hip bone. So if you find the hip bone right here, find your belly button right here, and kind of go part way between that. That's roughly where your psoas lies. If you can feel your six-pack muscles on the outside of your spine, you kind of go right to the outside of that rectus abdominis or six-pack muscle, and you can slowly sink in to the psoas there. And then once you find that, just hold a very gentle pressure there. Often you do have to do this for 2 or 3 minutes to get the muscle to totally relax. Now, if you can't get on the ground, you can also release your psoas lying on a couch with your legs up on the armrest, or lying on a bed with your legs up on pillows. But you want your hips and knees bent so that it puts your hip flexors in a relaxed position. And then the technique is just the same. You slowly apply a pressure through your abdomen. Now, another way you can release your psoas is by using a psoas release tool. This tool has 2 little plastic projections that fit inside your hip bones or iliac crest. and it hits right on your hip flexors, both your iliacus and your psoas. And you can usually get a little bit deeper with this than you can with your fingers. This tool was originally designed to lay on it this way. This can get quite uncomfortable. If you can do it this way, it does provide a great release. But for many people with lower back problems or sciatica problems, this can get a little bit uncomfortable lying on it. So I find that for many people, it's much more tolerable, particularly if you're experiencing a lot of pain, to lie on your back and then just apply the pressure down with your hands this way. Now I'll put a link in the description to this tool. As a note, the manufacturer did send this to me for free, and I do have a discount code that I do earn commissions from. So if you would like to pick one of these up, check out the link in the description below. Now the next self-massage technique that we'll do is for your hip muscles, and particularly a hip muscle known as the piriformis. The piriformis is located in the back of the hip, and it runs over top of your sciatic nerve, or in some people the sciatic nerve actually pierces through the piriformis. And if that muscle is in spasm, it can create pressure on the sciatic nerve. Now, one common way to release that is using a tennis ball or a massage ball. And to do that, you sit on the massage ball or on the tennis ball and just put it right underneath your buttock. Now take note that your sciatic nerve runs underneath the piriformis at a place called the greater sciatic notch. And you don't want to put pressure directly on that notch because that can create pressure on the sciatic nerve. You just want to release the muscle. Now where the piriformis runs is from your sacrum, which is right here, to your hip bone, which is right there. So you want to apply the pressure at either end. You don't want to apply it directly in the middle of the muscle. So if you want to get more towards the hip end of it, find the bump on the outside of your hip, put the ball right there, and then just kind of lean pressure over that way. Or if you want to hit more towards the tailbone, put it towards the back of your hip and apply pressure back there. But you don't want to sit right on top of it because that can put pressure on your sciatic nerve. Now you can go down at the sits bones down here a little bit lower than the greater sciatic notch. So if you come right down here where your hamstring muscles attach, you can also sit with a tennis ball on that sits bone right where the hamstrings attach, and that works out pretty well also. You can do this lying on the floor where you put the tennis ball underneath like that and then lie down here. This hits more towards the midline side of the piriformis. Or if you roll a little bit more onto your side like that, this is a little bit more pressure, but it hits more the hip end of the piriformis. Additionally, on your side, we use the massage ball for this one, you've got some muscles on the outside of your hip, your gluteus medius and gluteus minimus, and they can actually refer pain down the outside of your leg, which mimics sciatica. So it is often good to lie over on the piriformis like this and put pressure down on the outer hip using a massage ball or a tennis ball. The last two areas that I'll cover are the hamstrings and the calves. I'm going to combine these two together because a lot of the massage techniques that work for one area also work for another area. And one of those is just using a massage stick like this. Using a massage stick, you can hit a large area of muscle in a short period of time. These massage sticks don't get especially deep down into the tissue, which is good because you can just get the muscles to relax a little bit without going super deep and irritating the sciatic nerve itself. You can use it on the inside of your calves, the back of your calves, the outside of the calves. Same thing with the hamstrings. The hamstrings are a rather large muscle group, so you want to go through all the different areas on your hamstrings. So that's how you would use a massage stick. You can also do a manual release just using your hands. I find this doesn't work especially well for the hamstrings because they are such a big, thick muscle group, but just kind of pushing in there, finding areas where you may find some knots or trigger points. But this does work especially well for the calves. Many people will have trigger points or knots on the inside of their calves. So if you just kind of knead down the inside of the calf like this, it's very likely that you may find a sore or tender area. And when you do, just hold a gentle pressure there. Again, it's probably 2 or 3 minutes that you'll have to hold the pressure, but you should just feel like that knot sort of melts away underneath your finger over time. Another really helpful self-massage technique using your hands for this area is just right in the back of the knee. There's an acupressure point there called the bladder 40 or urinary bladder 40 point, and that's often associated with sciatica. So you just dig right into the soft spot in the back of your knee. Don't press really hard because you can get the nerve irritated, but just apply a gentle pressure in that back of the knee area. Another area is down deep in the calves, in your soleus muscle. That lies around the sciatic nerve, deeper behind the shin bone or the tibia. So just go on either side of the shin bone and kind of press in. And if you happen to find a sore or tender area down behind the shin bone, again, just hold a gentle pressure there for 2 or 3 minutes. Using a massage gun can also be helpful to relax your hamstrings and calves. This one is the Bob & Brad X6 Pro. It has a heated head, which actually feels pretty good and relaxing on the muscles. But you'd use this very much like manual massage or the massage stick. You just turn it on, and then you'd run it down the areas of the hamstrings and calves that are sore. If you are using a heated head, you do want to try to get it ideally directly over top of skin. But just go down the insides of the muscle, the back of the muscles, the outer sides of the muscles. Do note that with the calves, you have to be a little bit careful. Right on this bony part on the outside of your calf, you have a little bony prominence there, and a branch of your sciatic nerve, the fibular nerve, runs right behind it. So just be a little bit careful around that bony prominence on the outer side of your shin or calf. So those were some massage techniques to relieve sciatica. Let me know in the comments which ones you found to be most helpful. And if you'd like to learn some acupressure points to relieve sciatica, check out this video over here. Thanks for watching, and I'll see you in the next video.